Can you hear me? There are some people still looking for parking, but I think we'll start. Good evening. My name is Anna Stanton. I'm so pleased to welcome you here tonight on behalf of Berkshire County Resiliency Collaborative, BCRC. We are a local organization that shares a vision of health freedom dedicated to connecting community resources for healthy food and alternative healing. Thank you for taking the time to join us this evening for a timely conversation on reproductive health. This will be the third lecture on health BCRC has brought to this community. Your donations allow us to organize events such as these that aim to help and educate our community. I would like to thank Dr. Urato, Naomi Wolf, Mary Holland, and Deborah Sheldon to our community. They are truly distinguished speakers and will provide you with valuable information. We are very honored to have them and thrilled to see you all here. Please, everyone, let's give them another warm welcome. Welcome. The agenda for this evening includes hearing from our speakers. They will be introduced in turn and share their topic for 20 minutes. We will end with a Q&A and wrap up at 9 o'clock. Any questions you would like addressed during the Q&A should be written on the provided index cards at the front of the room, back of the room.
One is there and one is there. They're baskets with index cards and pens.
If you would like your question answered by a specific panelist, please write their name at the top of the index card. Your question card should be placed in one of the baskets located at the front or back of the room. I think they're all at the back of the room now. Lastly, I would like to thank Chris Novak, Anastasia Blaisdell, Carol Avery, and my husband, Toby Stanton, founders of BCRC, who have worked to put this event together. I would also like to thank our Q&A host, Dan Seitz from Health Rights Mass.
Hello, everyone, and thank you for coming tonight. My name is Anastasia Blaisdell, and it's my pleasure to introduce our first guest speaker, Dr. Adam Urato. Dr. Urato is a maternal fetal medicine physician with an active practice where he specializes in high-risk pregnancies and births in his hometown of Framingham, Massachusetts. Dr. Urato attended Harvard College and Harvard Medical School. He did his OBGYN residency at Massachusetts General Hospital and Brigham and Women's Hospital and his maternal fetal medicine fellowship at Tufts Medical Center. Dr. Urato writes and lectures on medication exposures in pregnancy and has been a leading advocate for safer approaches to maternal fetal care and informed consent. He's written articles on the subject of risks of SSRI exposure during pregnancy for publications such as the International Journal of Risk and Safety in Medicine, Mad in America, Science, Psychiatry, and Social Justice, Psychology Today, Oxford Academic, Risk.org, and other medical publications. Dr. Urato can be found in many interviews on popular podcasts available on YouTube, Spotify, and elsewhere. Please welcome Dr. Adam Urato.
I'll get right to it with the time limitations. Thanks so much for that nice introduction. I really appreciate it, Anastasia. And thank you to all of you as well as BCRC. And it's an honor to be here with Mary, Naomi, and Deborah. And we've got the mic set up. Okay, perfect. Thanks so much. That'll be better for my back. Okay, excellent. Okay, perfect. I'll be speaking today on medications and pregnancy. The semi-provocative subtitle, Are We Poisoning Pregnant Moms and Developing Babies? I have no conflicts of interest. I'm a community maternal fetal medicine physician. I've been doing obstetrics for 30 years, and it's a miracle. obstetrics is a miracle. Babies, moms, and babies in birth. It's also a miracle that I've been doing it for 30 years with the troublemaking I've been doing throughout my career. I wanted to give you an apology in advance. It's not really a laughing matter. It's. Okay, sure. Is this better? Okay. Okay, I'll lean in. Toby, is this counting against my time? Okay, I'll move it along. There we go. Thank you. Um, so I'm going to give you an apology in advance. The subject's sort of not a laughing matter, but I try to add some humor to it to keep my own sanity. My concerns really come from a place of compassion for patients. This is not about pill shaming or guilt tripping. That's not why I'm trying to raise these issues. I really support my patients, whatever they end up deciding to do. But I think the key is for compassionate care is proper information. We've seen over the last 60 years a massive increase in medication and vaccination use. Pharmaceuticals, I use the term pharmaceuticals, meaning drugs, medications, vaccinations. I like to say never before in human history have we ever been exposed to medications and vaccinations like this. And the data shows that over the last 60 years. So we're now basically the most heavily medicated humans ever to walk the planet. That we have a pill for every ill and vice versa, an ill for every pill. And I actually see this every day taking care of pregnant women. This is a unique circumstance as well as dangerous. And the reason it's dangerous is the point that I always try to make, which is that medications are chemicals and chemicals have consequences for health. Can you guys hear me okay better now? Yeah, great. I like to say medications are chemicals. Sometimes I've been interrupted and they say, well, water's a chemical. But what I'm talking about are synthetic chemical compounds. And they don't grow like oranges on trees. They come from chemical plants. The workers who are making, these are workers in a chemical manufacturing facility here on the slide. They wear protective gear. And they're wearing protective gear because they're working with chemicals. Chemicals have consequences. They have chemical effects. And if we really think about what's happening in pregnancy, we're getting the medications that are basically moving from the chemical plant into the prenatal clinic, and then in the prenatal clinic into the moms, and then they're going across the placenta into the babies. I show this here because I think if you can sometimes lose track of what's actually going on a physical standpoint. This, I'll confess, I made with AI just to have the chemical factory next to the prenatal clinic. They don't usually build and say prenatal clinic up there on there. But you get the point that they're coming across. The only thing I didn't like about what Grok did with this is I said, can you put a window between the mom and the doctor that actually shows the chemical factory in the background to really make the point? And then Grok did that, but changed the patient into what looks like another doctor, another medical professional. But if you notice the stethoscope she has two headsets on it. And it doesn't look like a doctor-patient now. It looks more like a budding workplace relationship between the two. Okay. Chemicals, I'm not against chemicals. I'm not a Luddite. Chemicals can sometimes help. For example, antibiotics. We have an infection in pregnancy known as pyelonephritis. A kidney infection, it can cause fever, sweating, etc. And in worst case scenarios, sepsis or death. So we use antibiotics for that. It can be life-saving for the mom. But that's only about 1% of pregnant women will get pyelonephritis. And it's an acute condition. We use the chemical in a very directed fashion. But it's much more profitable for the pharmaceutical industry to have people chronically using these. And we see this in pregnancy. This is old data from 2011, but this is looking at the percentage of women taking 4 or more medications at any time during pregnancy. That's the blue line. And then the percent taking 4 or more medications during the first trimester is the red line. And you can see even here in 2011, it was 50%. And I see this every day. It's not uncommon to see pregnant women in my office who may be on an antidepressant. They may also be on something for asthma. They may be on something for nausea. So very quickly, Tylenol, it very quickly adds up, and you'll see women on 4 or more medications. All medications cross the placenta, virtually all of them, except for the large proteins like insulin or heparin. This is a scientific explanation. This is the figure I actually like to use because you can see the pills and chemicals in the cord. They don't actually look like that, but if you picture these pills and chemicals as little pills and capsules as chemicals going into the baby, that's basically what's happening. The mom takes it, goes into her circulation, goes across to the baby. I apologize if I'm moving quickly, just I'm trying to summarize a longer talk. Chemicals can cause harm. We saw this with thalidomide in the late 50s to 1961. It caused limb reduction abnormalities. DES was used from the 1940s to the 1970s, over 3 decades, and caused clear cell adenocarcinoma in the offspring as well as congenital anomalies. Valproic acid used since the 1960s, still being used. People are aware of the problems in pregnancy. It can cause spina bifida. The other big problem, though, is those things are easy to see. Thalidomide, limb reduction abnormalities, obviously, spina bifida. But what about the unseen harms from the medications going across into the baby, particularly into the baby's brain? These unseen harms are concerning. And this is an important point. I tried to highlight some of the important points. So if you're only paying attention, you can just focus on the highlighted points. Human biology is complex, and we need to have much more humility with the way chemicals interact with our biology. We really have no idea how the brain works, how the brain's connected, all the chemicals there, and what the effects and the impacts these different chemicals have, particularly on the developing baby's brain. SSRI antidepressants, most people know these, Prozac, Zoloft, etc. This is the list of the main 5. These are the ones I'm focusing on, but so much of what I'm talking about applies to SNRIs as well as other antidepressants, and for that matter, other medications in pregnancy. Depression or anxiety or distress or suffering is an awful thing to suffer through. We see this in deaths of despair and suicide rates. This is data looking at annual deaths from alcohol, drugs, and suicides in the U.S. You can see all the bars going up and increasing. So this is an important topic, and nothing I say should diminish anyone's sympathy or compassion for people suffering. Human suffering shouldn't be ignored. The patients deserve compassionate care, but a big part of that compassionate care is accurate information. And a key to accurate information is discussing risks. And that's actually essential for informed consent. In terms of other benefits to these drugs, I'm not a psychiatrist. The actual evidence of benefit, though, in the studies of the antidepressants is fairly minimal. On a 52-point scale, the HAM-D scale, from the randomized controlled trials, it's about 2-point difference, which many people think is not clinically significant. Some patients do say they feel better, and there is a large placebo effect with these medications. When we look long-term, we don't really have good data. They've never really been studied for long-term use. Most of the trials are 6 weeks, 12 weeks, etc. And every brain is different, but it looks like there's a poorer outcome in long-term users. One big benefit, though, that patients I see, and from dealing with pregnant women every day, is this issue of withdrawal. Women that stay on their medications avoid withdrawal, so that could be considered in the risk-benefit calculation. When I mention risks, I often get asked, are SSRIs safe in pregnancy? I don't like this phrasing, safe versus unsafe. It's very inexact. I tend to focus more on the counseling regarding risk benefits and alternatives. In order to understand the risks of SSRI antidepressants in pregnancy, you can't just jump to the human studies. You have to march through common sense, basic science, the animal studies, and then get to the human studies. So from a common sense standpoint, in the big picture, and there's widespread scientific agreement on this, serotonin plays a crucial role in fetal development. The compound serotonin, it's a naturally occurring compound in the body. It plays a crucial role in fetal development. Part B is that the antidepressants disrupt that serotonin system. So if you just put that together, if serotonin plays a crucial role in fetal development, which it does, and if antidepressants disrupt the serotonin system, which they do, then the conclusion's obvious. Antidepressants will alter fetal development. The basic science shows this. This is a study from Zhang in 2020 that showed the effect of Paxil paroxetine on the neurons. You can see that as you increase the amount of Paxil that you're exposing the neurons to, they lose their neurites, they lose their branches, so that by the time you get up to 60, you see this very stunted neuron. Animal studies are the next thing you move to. So we've got common sense, we've got basic science, the animal studies. When we look at animal studies in zebrafish, frogs, rats, mice, sheep, etc., all of them show chemical effects or pregnancy complications. We see things like infertility, smaller litter size, maternal death, pup death, lower birth weight, and birth defects. And we also find longer term effects. This is a study that just came out, SING, in 2025, looking at treating rats with a newer antidepressant, vortioxetine. This shows that as you get increasing doses of that drug, you see smaller placentas, you see smaller rat offspring, and with smaller brains. It's just having a direct chemical effect. This is a study from 2026. I know we're not in 2026 quite yet, but it came out early. I saw it electronically early. It's the paper version's in 2026. This is from Prado Rivera looking at rats exposed to Prozac or fluoxetine, and this shows increased infertility. 12 of the 16 rats couldn't get pregnant being exposed to fluoxetine, whereas it was 11 of 12 being exposed to the vehicle. More maternal mortality and more pup death in the group that's treated with Prozac. So in summary, what we see from the animal studies is lower fertility, maternal death, smaller litter sizes, pup death, low birth weight. These are chemical harms. And in the animal studies, we actually can study long-term behavioral effects. I don't know what these rats and mice are doing here, but we know with exposure to the antidepressants, what we see is what's often described as autistic-like social behaviors in the offspring who have been exposed in utero. There's been studies showing increased fear behavior and altered sexual behavior. Male mice and rats that have been exposed prenatally to SSRIs, when they develop into adulthood, they behave differently sexually. Their sexual function tends to be impaired. So this is the summary before we even get to the human studies. Common sense, basic science, and animal studies show us these effects, these chemical effects. Then when we get to the human studies, what we see are similar chemical harms. And the grouping of them is here. We see increased rates in humans of, miscarriage, birth defects, preterm birth, low birth weight, preeclampsia, postpartum hemorrhage, poor neonatal adaptation, or a severe lung condition called persistent pulmonary hypertension of the newborn, as well as long-term effects. I'll move quickly through these in the interest of time. Human studies are challenging. So people will sometimes ask, do 100% of the human studies show this? Human studies are challenging because of exposure misclassification, meaning a woman gets the prescription. She's then in the study considered to be in the exposed group, but she never actually takes the drug. She never goes to fill it, or she fills it but doesn't actually take it. So you can get some challenges with the human studies, but virtually 100% of the studies show poor outcomes in the SSRI group. You hear a lot of the SSRI advocates say this, what I call a pharmaceutical propaganda or wishful thinking, that if the mom takes the SSRI, she controls her mood, she has a better mood, she has a better pregnancy outcome, but that's not what the studies show. It's virtually 100% of the studies showing worse outcomes in the SSRI group, and that goes along with this being a chemical exposure. So I'll move quickly through these. Miscarriage, virtually all of the studies show a link between SSRIs and miscarriage. You can see it from this meta-analysis. All of the bars are off to the right showing increases in miscarriage. This is SSRIs as well as SNRIs. Birth defects, there's plenty of evidence. Again, serotonin plays a crucial role in the formation of the embryo and the formation of the heart and the formation and embryonic formation and development of the pregnancy. If you disrupt that system, you're likely to get birth defects. That's what we see. Cardiac defects, neural tube defects, etc. This is actually data from the CDC. The bold in these in the next table are where there's statistically significant birth defects. You see it with a variety of these drugs, significant birth defects. In particular, if you look at the second to last one from the right, Effexor, venlafaxine, appears to be particularly severe in terms of links to birth defects. Preterm birth is delivery before 37 weeks. This is a major cause of morbidity and mortality. as well as short and long-term issues. This is a paper I was the senior author on back in 2014. And again, you see all the bars are off to the right, showing that virtually all of the 41 studies, we looked at 41 studies at the time, virtually all 41 of them are showing a link to preterm birth with SSRI use. Low birth weights also increased. That's a birth weight less than 2,500 grams. Again, that's the evidence. Preeclampsia is a disease that moms get, and I just want to point something out here. A lot of times in the discussion about antidepressant use in pregnancy, you'll hear this false dichotomy of it's the mom versus the baby. What's best for the mom is the medication, but that's not best for the baby. But that's actually not accurate. The drugs have chemical impacts on the mom as well, and we see that with increased rates, for example, of preeclampsia. This is a problem for the mom as well as for the baby. Again, this is some of the evidence showing the increase in preeclampsia. SSRIs and antidepressants increase bleeding across the board in surgery, across the board, because they affect platelets, and we see this in obstetrics with postpartum hemorrhage, increases in postpartum hemorrhage. So if you look at the leading causes of maternal death around the world, postpartum hemorrhage is the major one, as well as hypertension from this pie chart. And these are both increased. Postpartum hemorrhage and hypertension are both increased by SSRIs. And again, this is a problem for the mom. Here's why it happens. They have profound impacts on platelets. They basically stop the platelets. SSRIs block the platelets from being able to uptake serotonin, and serotonin is crucial for their function. So patients on these have increased rates of bleeding. Excuse me. As I was saying, this is a problem for the woman. It's also a problem for the obstetrician. This is something that we really worry about. I've been delivering babies now for 30 years, and all the time, at the time of delivery of a baby, it's always in the back of our mind, or actually in the front of our mind, hoping that there's not going to be a postpartum hemorrhage. This is actually a shot of me delivering a baby. I have it there. If you look, both myself and the surgical assist, we're both looking kind of down into the field. We're trying to show off the baby, but we're thinking, geez, I hope the patient's not bleeding. This is always first and foremost on our mind at the time of delivery. I've showed this picture before, and some people said it looks like I'm choking the baby, but I'm not actually choking the baby in this picture. I got the feet firm, but I'm loose on the neck like that. Okay, so I'm not choking the baby. The other risks are after the baby's born, poor neonatal adaptation, and this is affects about 85% of babies where the moms have been taking SSRIs. This is a variety of postnatal, immediately postnatal things like respiratory distress, difficulty feeding, jitteriness, irritability, constant crying, tremors, lung abnormalities, and it can happen in up to 85%. Newborn issues are no minor thing. The babies can end up in the NICU, and the difficulties can last for weeks, and this may be associated also with long-term problems. People always ask nowadays, what are the long-term issues? And this is still, we're trying to figure this out. It's very hard to study, but it looks like children exposed prenatally do have higher rates of speech and language difficulties, behavioral issues, depression, anxiety, autism, ADHD, constipation. Serotonin plays a crucial role in gut formation, and possibly sexual issues, although this has not been really even studied in humans, although the studies in animals are showing this. There is clear evidence that SSRIs alter fetal brain development. There have been now 12 consecutive MRI studies where they do MRIs on newborns and on children and even young adults, and we can see differences in the brain in those who are exposed prenatally. There have been 3 EEG studies and 2 prenatal ultrasound studies. I do prenatal ultrasound all day, every day. The fetuses move differently who are exposed to SSRIs in utero. We see there's less quiescence, less being settled down, more kind of jittery activity, and this is what we see also after birth. The public isn't being warned about these things. This is sort of the big thing I'm emphasizing now. The only thing the FDA is actually warning about is postpartum hemorrhage and poor neonatal adaptation, but we really need warnings on these other issues for the pregnant women and the public to be aware of this. So I put out a citizen petition in early September along with one of my co-authors, and we asked for a boxed warning on the SSRIs about these. If you want to help with this, you can go to my Twitter account, or I can give you the information otherwise to leave a comment. There's a public website where you can comment on citizen petitions and say, we support this citizen petition. So this is the top, my top tweet on my Twitter account, and you can participate by supporting that. Quickly, Tylenol, there's acetaminophen, the reasoning is very similar. We can't just jump to the human studies on these, but if you walk through common sense, basic science, animal studies, then get to the human studies, you realize that yes, Tylenol does have impacts on the developing fetal brain. And then vaccines, I know we're going to hear more about that, so I'll just put something in here quickly. Right now, pregnant women are routinely being given or offered 4 vaccines during pregnancy: influenza, Tdap, COVID, RSV, and there's more in the pipeline, Group B, strep, and others. Again, the reasoning is similar. We're exposing them to chemicals, but in particular with vaccines, there's a concern because we're causing maternal immune activation, and we know from infection and other studies that maternal immune activation can result in fetal brain injury and impacts on fetal brain development. So I started off by asking, are we poisoning pregnant women and their babies? Poisons, by Merriam-Webster, is a substance that through its chemical action usually kills, injures, or impairs an organism. I think based on that, we're injuring, impairing the development of the baby, and also causing harm to mom. The good news is the public is becoming aware of these things. More and more women are, I see in my office, opting to be chemical free, although it's important for us to keep pushing on this because many women think they're doing the right thing health-wise by being chemical-free in the supermarket, avoiding the foods with chemicals and other things, and then making sure that they're getting all their vaccines and that everyone in their family is getting all their vaccines. They don't understand that chemical aspect of it to the medical care. So what can you do? Help get the word out on this. Activities like this are a big help. Thank you for doing this. And yeah, I think I got in under the time limit. A big thank you, you guys.
Okay, that was a speed lecture. All right. Thank you. Thank you, Dr. Urato. Whoop. My name is Carol Avery, and I take great pleasure in introducing my friend, President, General Counsel of Children's Health Defense, and author, Mary Holland. Before joining CHD's staff, Mary taught on the faculty of NYU Law for 17 years and lectured at Columbia Law School on international human rights. She has co-authored or co-edited 3 books on vaccines, including HPV Vaccine on Trial, Seeking Justice for a Generation Betrayed, Vaccine Epidemic, How Corporate Greed, Biased Science, and Coercive Government Threaten Our Human Rights, Our Health, and Our Children, and most recently, Turtles All the Way Down, Vaccine Science and Myth. Mary Holland has spoken in Congress, at state legislatures, and internationally on informed consent and vaccination. She appears weekly on CHD TV podcast, This Week with Mary and Polly. Please go to childrenshealthdefense.org for more information. And Mary, are you ready? Almost. Do I need to keep talking? Okay.
I have to get the right view though. Shoot, let's see. Bear with us here. Thank you. And I just want to get the right view. Let's see. On slideshow. Thank you. Is this slide here? Join it now. I'm just worried that, okay, that should work. Okay, all right. And, okay. So I want to talk sort of more broadly. I thought that was a fascinating presentation, Dr. Urato. Thank you for that. So I think I'm going to talk more broadly about sort of public culture and then about some of the toxic exposures that are definitely having a role. Okay, that's better. So I actually think there's sort of a paradox in public culture that on the one hand, since I've been alive, we've been told about the population explosion and the absolute need for population control. And at the same time, we see that there's been this seeding of ideas that there will be test tube babies. Aldous Huxley's book, Brave New World, from the 30s and then updated in the 50s, was really about how there will be governments that run test tube babies, and everything will be done according to basically a case system. Really important film, Children of Men in 1990, shows us a time when all humans are infertile and no babies are born of women. It's a really fascinating movie made 35 years ago. And then, we're in the era now where mainstream media is talking about designer babies. It's happening in Asia, and there's a lot that's being written about this right now with DNA manipulation, CRISPR, and so on. So we are in an interesting time historically in the world where we are starting to see the rate of growth go down dramatically of the population worldwide. The population is continuing to grow, and will level off, sort of towards the end of this century. But the rate of growth you see is this purple line, and the annual rate of growth is declining remarkably, right? So the high point was 2.3% rate of growth in 1963, and here we are, 2023, 0.9%, and going down to below that. Okay, so the U.S. population growth is slowing dramatically as well. So the U.S. is sort of consistent with other countries around the world. You can see that the growth, if you look here at 2020 is down from 35 to 8% and projected to continue to go down. So the rate of growth is slowing again. The population is continuing to go up, but the rate of growth is slowing dramatically. So, the idea that population should be controlled is not a new idea. And I want to point out that there have been efforts around sterilization for a long time, and that the U.S. Supreme Court back in 100 years ago authorized sterilization as a criminal and civil penalty in a case called Buck v. Bell. And it was it's an extraordinary case. It's never been formally overruled. It's better for all the world if instead of waiting to execute degenerate offspring for crime or to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. The principle that sustains compulsory vaccination is broad enough to cover cutting the fallopian tubes. 3 generations of imbeciles is enough. And needless to say, these were not imbeciles. It actually was a young girl who was raped. It was actually brought very intentionally by the Rockefeller Foundation, a very particular case, to justify sterilization. And the sterilization, of course, was taken to a whole nother level by Nazi Germany. But the idea of population control is not a new idea, and it's a really mainstream idea in the global control, if you will. So 1972, John D. Rockefeller, under President Nixon, led a 2-year commission on population growth, outlining the need to stabilize the population, to liberalize abortion, to have greater research for population control, to keep immigration high, to ensure legal status for all children, and having government structures around population growth. So we saw just a significant emphasis on how to do that in the U.S. population. Overseas, this was secret for many years, but there was a Kissinger report from 1974, which was very specifically about the U.S.'s need, in his view, to lower population in the developing world. That the developing world, if the population continued to grow at the same rate, presented a great threat to American so-called national interests. And so it's a very explicit cry from 1974, CIA classified, that the U.S. should aspire to limit population growth in the developing world. On the left here is a poster for a movie that we made called Infertility, A Diabolical Agenda. It's a really fascinating film that's for free on our website, on the movie site, CHD-TV and then movies. It's about a World Health Organization program in Kenya, and it's very well documented that they were giving vaccines to cause miscarriage to women of childbearing age. It's a half an hour. I recommend it. So here's just some some of the highlights from articles on the internet about all of the countries that were forcing sterilization, particularly on indigenous populations of women. So Denmark apologized for sterilizing women in Greenland. Canada apologizes for forced sterilizations of indigenous women. Namibian women were sterilized without consent. Roma women in Slovakia. Women in the United States, I think we got it one. We didn't get one. I tried to get one. Anyway, California did not outlaw. Women were being sterilized in California prisons until the 1990s. This is not a new issue. Although sterilization is considered a war crime under the Rome Convention, International Court Convention. So globally, not only is the global birth rate declining, but the global birth rate is declining. It's interesting. I was driving in the car recently and had National Public Radio on, and there was a story about how is the whole world going to be coping with this declining birth rate. This is mainstream news. It's on NPR News, right? So yeah, fertility is declining. The U.S. is basically below replacement, but even in Africa, the population growth is considerably lower than it's ever been. So the U.S. right now has the lowest birth rate ever recorded. It's below replacement. We're now just below replacement. So it's not only women are having fewer babies, and some of that is absolutely voluntary. I absolutely support voluntary birth control methods, but some of it is not voluntary, right? So one of the things that we're seeing is that male sperm counts have collapsed by more than 50% in 40 years. That's quite extraordinary, and we'll talk about sort of what may be behind that, and that this decline in sperm counts is increasing. Another thing that I think is worth pointing out is that not only does the U.S., I think I can show you the next slide, have the highest infant mortality, so death before age 1 of a toddler or a baby. Not only do we have the highest rate in the developed world, but we're below Poland, we're below Slovakia, we're below Greece. It's quite extraordinary. And actually, it's now since 2023. Corresponds with COVID, the rate of infant mortality has gone up for the first time since it's been tracked since 1995. So basically, fertility, approximately 12 to 15% of couples are unable to conceive. The number of women who have had difficulty conceiving, over 25%. It's a real issue. Just like chronic disease, it's a big business, right? So in vitro fertilization is making billions of dollars, 5.28 in 2023, projected to grow to 9 billion by this year. Globally, the market 2023 is about $20 billion. It's projected to be nearly $50 billion by 2033. So people are making money on this, no surprise. So why is this happening? Aside from voluntary choice, and I don't want to diminish that, why are sperm counts going down? Why is fertility going down? So I absolutely think that chemical exposures, like our colleague was talking about with acetaminophen, SSRIs. So those are some of them, but there are others. There are lots of toxic chemicals in our environment. Electromagnetic radiation is definitely potentially linked. Geoengineering, these are all toxic exposures that we're all being subjected to. Vaccines, for sure. I'm counting on the fact that Naomi will tell us more about COVID shots. But I want to point out to you that on almost all of the vaccine inserts, they say explicitly that it has not been evaluated for the impairment of fertility. They're basically telling you on all of these vaccines, here's the hepatitis B, here's the Rototec, I don't know which one, this one, Boostrix, this is the DTaP at the bottom. They're all telling you, we don't know if it's causing harm to fertility. Well, it is causing harm to fertility in some of these cases, but they're telling you very explicitly, we don't test these for impairment of fertility. That's pretty extraordinary. These are, Tdap, flu, respiratory syncytial virus, Hep B, Hep C, these are being offered, COVID, these are all being offered pretty universally. So here, our daily publication, The Defender, online at childrenshealthdefense.org, we cover these issues a lot. So here are articles that we've published about particularly this RSV shot causing severe issues in babies. The RSV shot is a monoclonal antibody shot. It has been recommended for all babies at this point.
Um, so I have copies of a book and another book, Turtles All the Way Down to the Back. But several years ago, I co-wrote this book about the human papillomavirus vaccine. Until the COVID shots, the Gardasil shot was really the most injurious. And in particular, it was being advertised as a solution for cervical cancer. That's a fraud. But beyond that, it's affecting women's fertility, right? It's affecting women's cervix and fertility system, if you will. And it absolutely had enormous impacts for miscarriages, for fertility issues, in many cases caused cervical cancer. I can answer questions on that if you want. But, in cervical cancer, if you got Pap screening, if you got regular checkups for women every 3 years, even to see if you had any abnormal cervical growth, you absolutely did not need to take an HPV vaccine. So the HPV vaccine is big money. It's in most countries of the world. It's being very aggressively pushed in many countries. I was just talking to Dr. Sherry Tenpenny today, who was saying that they're really trying to mandate the HPV vaccine for all kids, girls and boys, in the UK right now. For sure, this one has significant fertility effects. It's given to kids basically starting about age 9. The target is like through about 13. It's authorized for people into their 40s. So electromagnetic radiation, we have a lot of materials on our website, childrenshealthdefense.org, on electromagnetic radiation. That's definitely something that Pittsfield, we were very involved in a case here, a legal case. But there are many scientific articles about the impact of electromagnetic radiation on fetal growth, on fertility. It's definitely an issue, probably not as well recognized or studied as needs to be, but effects on sperm, effects on miscarriages, effects on pregnancy. I don't think there's any study that I could find on geoengineering, but geoengineering, the skies are spraying aluminum, other heavy metals, obviously not a good thing for fertility. So I just want to sort of in closing talk about the agenda. I think we need to really understand that there is a global agenda, which is embraced by very significant parts of the U.S. Leadership at the national level, Agenda 2030. And one of the things about Agenda 2030 is the immunization agenda. And the immunization agenda is about having a 90% uptake of all of these vaccines, 12 vaccines for all people by 2030, right? And they want to reduce what they call zero-dose children, unvaccinated children, by 50% by 2030. So, they're talking about HPV vaccines, they're talking about polio vaccines, they're talking about meningococcal, they're talking about, Tdap and hepatitis B, rotavirus. They're talking about everybody being vaccinated from cradle to grave. You don't get to 90% uptake of vaccines without coercion. So, in between the lines here there is a global agenda of the United Nations, of the World Health Organization. I don't think you can read it any other way than that there is an agenda for coercive vaccine policies. I'm not saying they're going to succeed, but I think it's very important that we understand that. I also think that we are in an incredible era of, robots and artificial intelligence now proliferating at a level and faster than has ever happened before. So the World Economic Forum is actually connected to the United Nations by statute, by formal agreement. World Health Organization, sort of the ideologue for the World Economic Forum is Yuval Noah Harari. And he talks explicitly in terms that are more familiar from Nazi ideologues about the massive class of useless eaters. AI will make humans redundant. What can we do with the humans? We need to keep them happy with drugs and computer games. This is somebody who is actually very influential in the world. These are terms that are chilling. They're absolutely chilling terms. This is, for fun, except it's not. Mr. Bourla, who headed Pfizer, and Naomi will tell us more about this, he's a veterinarian by trade. He's not a physician. He says that COVID was a rehearsal. Steve Kirsch in our Health Freedom Space says, what his area of expertise was about controlling the fertility of sheep and goats. You can't really make this up. So, not good news. I'm sorry to sort of end on a somewhat negative note,
But following this fertility issue and the population issue is really interesting. You can actually check online. I think this is called population clock. Anyway, so I think that's it. I have 5 minutes to go. I ended early. Thank you.
Thank you, Mary. I would like to introduce our panelist, Dr. Naomi Wolf, journalist, author, and political consultant. Sorry. Among many accomplishments, Dr. Wolf is a former Rhodes Scholar, a best-selling author, columnist, and professor, as well as former advisor to the Clinton re-election campaign and to Vice President Al Gore. She is recognized as one of the world's most influential feminist writers. Dr. Wolf is co-founder and CEO of Daily Clout, a successful civic tech company, where you can find her as well as on Instagram, X, and YouTube. Dr. Naomi's books include, among many others, her most recent publication, The Pfizer Papers, Crimes Against Humanity, The Bodies of Others, Facing the Beast, the international bestseller, The Beauty Myth, Misconception, Truth, Lies, and the Unexpected on the Journey to Motherhood, as well as New York Times bestseller, The End of America and Give Me Liberty. Please welcome Naomi Wolf.
Thank you. Thank you so much, Anna. I want to thank all the people who put this amazing evening together. It's like a little glowing bubble of sanity in the middle of what seems like the matrix of dystopia, and we're only halfway through the evening. I want to thank all of you who came here tonight on a cold night to deal with some very difficult material. You know, this is not, chick lit or an escapist film here. And I just want to thank everyone who made the wonderful brownies and homemade apple cake. And I'll launch right in because time is limited. I'm not a medical doctor. I'm not a scientist. But I found myself thrust into overseeing a really extraordinary project in which 3,500 doctors and scientists came together to read through 450,000 pages, documents, some of them many thousands of pages long, that were released under court order when lawyer Aaron Seary successfully sued the Food and Drug Administration for the release of those documents. And the FDA asked the court if they could please allow them to keep them hidden for 75 years. How better do you say transparency than that? So I was actually step back for a moment. I was canceled in 2021 very abruptly all over the world, all at once. AI hadn't been announced yet, but I think it existed because all over the world, because I accurately reported something that I've been writing about for decades, which is women's sexual and reproductive health. I accurately reported that women were experiencing menstrual disruption or dysregulation symptoms when they received the mRNA injection. For that accurate statement, which later was confirmed by many, many peer-reviewed studies that this is really happening, I was canceled. And it was bizarre. I got kind of kicked out of every legacy media platform I'd been commenting on for decades. I've just been such a fixture on the left or in the legacy media for decades, and kind of celebrated for having looked at women's sexual and reproductive health. And so doing the exact same journalistic work, I was suddenly a conspiracy theorist and a pariah and a lunatic. And it was bizarre. But what happened to me personally wasn't important. But it as a journalist, I realized there was a story there. There must be smoke here or fire here because there's smoke. But the effect of that cancellation was that no one would speak to me from my usual worlds. And the one person who would speak to me was Steve Bannon. And I, of course, was a Democrat my whole life, and I believed that he was, the devil himself. But I will talk to anyone about women's sexual and reproductive health. So I talked to him about what I was hearing from women. These were eyewitness women's accounts of their own bodies. And Feminism 101 is listen to women, right? Women are entitled to say, my period is weird, or I don't have a period anymore, whatever. They're literally telling their truth about their own bodies, and this was suddenly taboo. So he gave me a platform, and live on air one day when the Pfizer papers were released, he said, well, of course, Naomi, you're going to convene a project in which you crowdsource with doctors and scientists the reading of these hundreds of thousands of documents. And I was like, sure. Uh, so that's how it began. I'd never done anything like that before, but Providence is interesting and weird. A woman with all the skill sets I didn't have, Amy Kelly, was sent into our midst, and she oversaw this amazing thing that these highly distinguished cardiologists, anesthesiologists, medical fraud investigators, um, biologists, statisticians, biostatisticians, people from every discipline you would need from all over the world came together for 2 years for no money for the service of humanity and the service of science, real science, to go through these documents, which are extremely dense, and then produce 109 reports, which I then had the laborious challenge of turning into kind of journalistically readable language. And Amy Kelly and I edited those together. So that resulted in this red book that you see in the back. And we brought what was in the Pfizer papers to the world. So I guess I just want to pause for a moment to say what I just heard from Dr. Urato and from Mary Holland, and what I'm sure I will hear before the night is over, is like the most important information humanity could possibly hear. And it should be on the cover of the New York Times and the Wall Street Journal and breaking news on CNN. But it is a bunch of us in our Birkenstocks in a community center in the middle of Lenox, Massachusetts, thanks to a handful of brave people who decided to put this together, who are the audience for this right now, which is surreal. Like, I don't even know how to process it. Now, I have to believe in God at this point in history, so I'm going to believe that what happens here tonight is going to make it through to the world somehow to a larger audience. But I'm horrified that two of the most compelling presentations I've ever heard in my life about this subject, and one more to come, are that it's up to us, that we're doing the heavy lifting. And CNN is taking the checks from Big Pharma and is not going to cover it. This is suicide for the human race if we don't pay attention to this, to what these people have said and what we're going to hear after me. So now let me tell you what's in the Pfizer documents. So basically, list after list of general horrors, right? They knew a month after rollout that the vaccines didn't work to stop COVID. And their language is failure of efficacy and vaccine failure. And the third most common side effect in the Pfizer papers is COVID. Okay, you got to put that together. All right. So everything that followed, the mandates, the lost jobs, the broken families, the side effects, the deaths, based on a lie. It never stopped COVID. They knew that it didn't stay in the injection site, though they told you it stays in the deltoid. No, it biodistributed. Our Dr. Robert Chandler found this, confirming earlier Japanese studies, biodistributed to every organ in the body. As Dr. Urato points out, it doesn't just stay where you put it. These things are systems. And so it accumulates in the liver, the adrenals, the the lymphatic system, it crosses the blood-brain barrier, it accumulates in the spleen, and if you're a woman, it accumulates in the ovaries. Now, our experts found no mechanism by which the materials of the injection, the spike protein, the lipid nanoparticles that are covered in polyethylene glycol, which is a petroleum byproduct, the mRNA, there was no mechanism by which it leaves the body that they could find. So what this means is, with the first injection, some blocks your ovaries. With the second injection, more blocks your ovaries. Then there's the booster, right? And my husband, who's a PI, found legally on the CDC website a form where they were planning for 6 injections. Okay? So they knew that. They hired 2,400 full-time staffers to deal with the flood of adverse events that they knew would follow. There were 43,000 serious adverse events in the 3 months that the Pfizer papers cover, and 1,200 deaths. They knew by May of 2021 that minors' hearts were being damaged by the injection, but instead of coming clean and telling everyone, our FOIA showed that there was a massive cover-up in which everyone, right, Dr. Walensky, Dr. Fauci, a form bringing it up to POTUS, to President Biden, 15 White House staffers convened frantically to do damage control, and it resulted in a 17-page script, which you heard all that summer, saying it's safe and effective for your teenager, with all these influencers saying get your teenager to take it, and that script is completely redacted in our FOIA. All right. The serious adverse events, we were told that they would be like fever, chills, fatigue, but they knew that the serious adverse events are catastrophic levels of, well, interesting, number one is myalgia, which is muscle pain. How many people do you know who just feel bad, right? Number two is joint pain. How many people do you know who weirdly broke their ankle, dislocated their hip? Young people, right? Knee issues, right? Other arthritis in otherwise healthy people. How many people typically, I mean, you look at the street and people are limping, right? I mean, compared with before the rollout. They knew that. They knew that they were going to do that. And the third, as I mentioned, is COVID. But in addition to that, catastrophic industrial scale strokes, hemorrhages, blood damage, thrombotic thrombocytopenia, clotting issues, catastrophic variations on heart damage, pericarditis, myocarditis, blood clots, lung clots, leg clots, weird skin problems, eye issues, blindnesses, strokes, just catastrophic damage to the human body. And they knew this. But all the horrors that I could spend hours itemizing really were not the point that emerged from our expert study of what's in the Pfizer papers. What became clear at a certain point, I didn't want to see it, I wanted to deny it, but at a certain point I couldn't, is that the centerpiece of the injection rollout is the 360-degree attack on human reproduction. So in every way. So Pfizer knew, for instance, that, well, there's a place in the Pfizer papers where 80% of the women that they studied lost their babies, miscarried. You weren't supposed to get pregnant. In the study, they actually told men and women to use they told men not to have intercourse with childbearing age women, which is weird, right? But if they did, to use 2 reliable forms of contraception, 2. So Pfizer knew that there's something in the sperm of vaccinated men that could be injurious to unvaccinated women. But they still, to this day, won't tell you. They define exposure to the vaccine as including skin contact, respiration, and body fluids. So nonetheless, 270 women got pregnant. Pfizer lost the records of 234 of those, which is illegal. So it could be even worse, right, than what we know. But of the 36 that were left, over 80% of them lost their babies. Pfizer knew that, they knew that, oh God, they knew, as I mentioned, that the vaccine materials were blocking ovaries, and midwives have told me that now when there's and surgeons have told me that when there's abdominal surgeries, I'm sure you know more about this than I do, but that they see that women who aren't even in there for reproductive reasons, but their childbearing age, their ovaries are blocked. Pfizer knew that the materials cross the placenta. Of course, these lipid nanoparticles have been known for a decade to cause reproductive damage. Why are they even in there, right? They knew this. But they also cross the placenta. And so not only do they cross the placenta, they cross into the amniotic fluid, they cross into the fetus. Not only that, they cross, and Amy Kelly found this, they cross every membrane, right? So the sac around the testes is a membrane. They degrade the sac around the testes of baby boys in utero, thus degrading the Sertoli cells and Leydig cells, which are the factories of the hormones that turn on masculinity in adolescent males. The deep voice, the broad shoulders, body hair, facial hair. So we don't even know, per your point, we don't even know what baby boys who haven't even been vaccinated themselves, but their moms were, whether they will develop into normal, mature adult males who can father children, right? They knew that the vaccines would damage the placenta. 2 different midwives contacted me. One sent me photographs. In journalism, when you get 2 confirming reports from independent sources, it's confirmed. And they said they're seeing placentas, and I'm sure this is not news to you, that are flattened. They're pancake-like. And they showed me that a normal placenta is like rich and thick and well supplied with oxygen and blood vessels, and these are flat. And that they have to deliver babies early because the placentas are falling apart. And to your point about maternal deaths, there's a 40% rise in women dying in childbirth because of the hemorrhaging or the risk of bleeding from these damaged placentas. The most horrific document in the Pfizer papers, I believe, is called the Pregnancy and Lactation Report, and I only have a few minutes left. It's an 8-page report, and it was created on April 20th, 2021, and it went to the White House. It went to Dr. Walensky. It shows a chart that categorizes, and I think of this as Nazi medicine. You mentioned Nazi language, Mary, and you're absolutely right. And what the useless eaters language, there's so much Nazi language and Nazi science in this chart. It in this method, it shows tens of thousands of women suffering by menstrual damage. So it's a spreadsheet. It's like 15,000 women bleeding every day after being vaccinated, 10,000 women bleeding twice a month, 7,500 women having no periods at all, meaning they're totally infertile. Then 10-year-old girl bleeds upon being injected. 85-year-old women menstruates again upon being injected. Women casting their uterine linings, right? Hemorrhages, clots. And this is all just itemized like a spreadsheet. Ruined lives. And they also have a chart showing damage to babies because the lipid nanoparticles, polyethylene glycol, get into the lymphatic system and the blood, which of course gets into breast milk, right? So these vaccinated moms are nursing now their babies. So the babies are being poisoned by these materials. This spreadsheet shows this many babies were vomiting. This many babies have failure to thrive. This many babies have edema, which is swollen tissue. One poor baby went into convulsions and was rushed to the ER and died of multi-organ system failure. And so these babies are just like, we're making the baby sick, we're making them very sick, they're very sick. It's a chart. Did the people who got this, the Biden administration, the president, Dr. Walensky, did they say, hey, vaccinated nursing moms, stop nursing your babies because you're going to make them sick? I'm sorry, we've poisoned you. For your point about poison, no, you never heard that. To this day, you didn't hear that. And by the way, Did baby formula vanish weirdly in the middle of this process, driving moms to have no alternative but to breastfeed their babies with poisoned milk? Another chilling thing in this document is that 2 babies died in utero, right? Late term abortions, miscarriages, spontaneous abortions. And the language says that this was due to, quote, maternal exposure to the vaccine. They knew it. And this report saying, hey, it's effective. In the tech world, we say it's not a bug, it's a feature. So at this point, this report is saying, hey, this works. They're losing their babies. It works. This went to the White House. It went to Dr. Walensky. 3 days later, Dr. Walensky, who is a mother, gave a press conference from the White House telling the women of America that there is no bad time to get a COVID vaccine before your pregnancy, during your pregnancy, or after your baby is born. So I will end, there's so much more, but I will end by saying, COVID is a respiratory disease, right? And it's supposed to be spread through inhaling particles. We heard all about that. There's virtually nothing in the Pfizer documents about lungs, mucous membranes, nasal passages. It all centers around sex and reproduction. Like literally they would mate male vaccinated to female unvaccinated rats, sacrifice the rats, and then scrutinize the cells of their reproductive organs. Right? What does that have to do with COVID? Right? So it's all about sex and reproduction. And I will tell you that since this injection has rolled out, multiple studies, Igor Chudov is a mathematician, he compiled multiple studies of government databases showing a 13 to 20% drop in live births, but especially in the Western world. And we also analyzed independently Canadian data from one province, and it confirms this, a 15 to 20% drop in live births. So women aren't being told, men aren't being told that this is happening, that this is why they're feeding into the multi-billion-dollar artificial fertility assistance industry. But I believe that this was intentional. If you look at the serious adverse events, they're grossly disproportionately in the West. Number 1, North America. Number 2, Western Europe, in order of political importance. So Britain, France, Germany, Greece, Italy, Spain, and all the rest of the world combined adds up to only 7,000 serious adverse events. So I believe that this is an attack on the West. I believe that the goal is to disable, sterilize, and kill off the West, and then create a different future for the West, a lot more aligned with the slide that Mary showed of a kind of post-human world. So God willing, that's the end of my time. We, tiny band of brothers and sisters and our friends, will fight this with the help of divine providence. More difficult things have been accomplished. And I want to just thank the people again who put this together, thank all of you, and really say what an honor it is for me to be in the room with these heroes who are behind me. Thank you so much. We'll fight this.
While our last guest is setting up, everybody take a deep breath. Whew. And I want to remind you, I'm sure you have questions, and we'd like you to write them down on a card. There's cards back at either table and a basket you can put them in. Don't everybody get up at once, but do that. That'll help us to control our question and answer time. And our next guest, last but not least, is our Columbia County neighbor, Deborah Sheldon. No, closer to the mic. Deborah Sheldon. And Deborah Sheldon is Vice President of the Make America Healthy Again Institute, or MAHA Institute. It's a nonprofit think tank that aims to revitalize health in the United States. The Institute focuses on reforming the political, regulatory, and legislative environment at both federal and state levels. The MAHA Institute combines the intellectual assets of the top thought leaders of the MAHA movement with the dedication and passion of grassroots activists, furthering the values in all of our values in state capitals and communities across the 50 states. You can go to their website. It's mahainstitute.us. mahainstitute.us. So, to wrap us up here, Deborah?
Wow. I don't know about all of you, but I feel like I kind of have to put my hand on my heart for a minute and take a deep breath. Thank you so much, Mary and Adam and Naomi, for those really powerful presentations. What I'm hoping to, first of all, and thank you, Carol and Anastasia and Anna and everyone for being here. It's really a privilege to be here, and I'm so grateful. I'm hoping that what I'm about to present about is actually kind of a soothing closure. We already kind of have heard a lot about the chaos agents, and so kind of where I want to begin here is to talk about fertility and kind of how we can kind of restore some sort of a beautiful cosmological sort of wholesomeness, I guess to say. So I love this image, by the way, and throughout most of human history, men and women were perceived or represented as archetypes, represented usually men as the solar archetype and women as the lunar. And this coincides with their life force and their fertility cycles. And I think a lot of times we actually don't have these kinds of representations to look at, and we're somewhat disconnected from these archetypes and from this from our very basic biological life forces. Sorry. I'm working on, excuse my tech problems today. We've had some challenges. For the purpose of this presentation, I'm going to focus on women's fertility because it's the area that I know best and I'm the most passionate about. I think we have a really important story to tell and need to reclaim, first and foremost, body literacy, especially at this time when so much of our rights, our parental rights, are being stripped from us and woke ideologies are making their way into our children's classrooms. And as a result of that, I feel what's really happening is that we don't have a preservation of the sanctity of this space to honor thresholds. So women's cycles reflect a universal pattern of birth, growth, full bloom, harvest, decay, death, rest, and rebirth. And this cyclical nature mirrors the cosmos and underscores the interconnectedness of life. To me, this is a very sacred kind of space, and that's why I feel like I want to bring us back to this basic understanding of how this works. For a few reasons, but first and foremost, how can we truly practice informed consent for anything? For our children, for taking a drug, for getting medical treatments, if we actually don't have a full understanding of our own fertility. And I think most people actually don't. It's been my experience that most people actually don't have an experience of understanding their cycles and how they're synced with each other and the moon, and men and women synced with one another, and how all these things are connected. So I wanted to start first with kind of creating a bit of a picture of the cosmos. So, sorry, I'm actually working on two different computers. Okay, we could probably spend all night just on this basic image. If you can see, there are a lot of things going on here. There's the rising and setting of the sun, there's the lunar cycles, there's the cycles of a woman's life, and there's the cycles, and there's the seasons on Earth. And these things are actually really important because they all align energetically. So if you think about, for instance, the experience of a woman, she's born into life. This largely coincides with the energetics of the dark moon, the bleed, the regenerative aspects of the womb lining. The spring equinox generally coincides with the maidenhood aspect of life, the onset of menarche. This is a sort of a birth, an increasing energy for women. Sorry, I'm a little bit. Excuse me for a minute. synchronizing our understanding about how the seasons of our life synchronize with our cycles and how the sort of aspects of our cycles are also telling us something about our well-being is a very is it sort of something that I feel like has been stripped from a lot of us. It used to be fairly common that women would track their cycles and understand various points in their cycles. For instance, when they're in their follicular phase, how they have increased energy or they're feeling sort of more creative leading up to their ovulatory, leading to the birth of the egg, which largely coincides with the kind of energetic that we find around the summer solstice and the kind of ripeness and the full bloom of motherhood. And then moving into the grandmotherhood or the sort of harvest of life, this coincides with the uterine lining not needed anymore, the shedding of the uterine lining, breaking down into the sort of bleeding of her menstrual cycle, where most women, when they're bleeding, really do kind of feel the tendency to want to kind of be alone in a sort of a deeper space of relaxation. So there are a lot of synchronicities that we experience, including the obvious, the lunar synchronicities of a woman's cycle with the 28 days of the lunar cycle, the season and earthly rhythms, and one very important one is the inter-women menstrual synchrony. Women cohabitating in very close emotional proximity often synchronize their bleeding. And sometimes we've referred to this or understood this as the red tent or the shared rest or wisdom sharing, and it amplifies the kind of collective power of women. So you could imagine what would happen if 500 million women were bleeding at around the same time. Right. So these synchronicities are obviously there's some broader cosmic and universal patterns that are really important for us to connect with. I'm not going to go into details here. But what I do want to say is that in general, and it's been, I think in 2015, the College of Obstetricians, the ACOG, American College of Obstetricians, recognized that women's menstrual cycles were the 5th vital sign. So as important as things like pulse, heartbeat, things like that. But I don't think that many women actually understand their cycles as harbingers of their overall well-being, though, as Naomi pointed out, no one's listening to women when they actually do, so this is really problematic as well. But the more attuned women are to their actual cycles and the more literate about what deviations in their cycles actually mean, provide very valuable insights. And I'm just going to name a few. Sorry. Thyroid function, hypothyroidism, people with longer cycles, heavy bleeding, who experience fatigue. Hypothyroidism, short cycles, light or absent periods. Cycle irregularities is often the first sign of thyroid imbalances even before the blood tests show it. All of the adrenal health indicators, high cortisol from chronic stress, anovulatory cycles, there's no ovulation, short luteal phases, spotting before periods. These are all indicators of problems that if you do not have a natural cycle, you will not experience. Your cycle is indicative of your nutritional and metabolic health. Low energy availability means maybe under eating or intense exercise. Amenorrhea or missing periods, luteal phase defects, insulin. All of these things, if you're tracking your cycle, you will actually be able to it actually provides insights into your overall health. So what happens, for instance, when the chaos agents come in and create asynchronous with life cycles? Routinely, as we all know, young women and girls are offered interventions to chemically regulate their cycles. So what happens is a girl goes in, maybe she's athletic, maybe she's having a heavy bleed, maybe she's not eating well, maybe she's not sleeping well, maybe there are emotional issues or trauma or underlying conditions that affect her cycle. She goes into the OB at the onset of her cycle, and they offer her hormonal birth control to, quote, regulate the cycle. What it actually does is actually strips that girl of actually having a cycle altogether. Birth control does not regulate, it eliminates the cycle. It creates a fake sense of pregnancy. The ovaries do not release eggs. The chemical bleed is not a true bleed. So if you don't have access to one of the most basic indicators of your overall well-being and of your basic synchronicity with all other iterative life-bearing cycles, clearly you are in a place where you're very alone, first of all, and you're divorced and you're disembodied from your actual experience of your most creative life-bearing force within you. So, oh, I'm Sorry. So I think I'm not going to go into full details here because almost everybody has touched on these: the toxicants, glyphosate, mRNA, obviously hormonal contraceptives, microplastics, which carry endocrine disruptors. It's very difficult to find cotton underwear, among other things. These are really basic things. Medicalization, SSRIs, all of the psych meds, artificial lighting, it dysregulates melatonin, a master regulator, okay? Puberty blockers, cross-sex hormones. These are irreversible interventions when it comes to fertility. Food, lifestyle, spiritual, emotional, they're not, even though they're at the bottom, they're actually not trivial. These are massively important aspects of life, but they're actually, the bigger criminal ones are the ones that we know are actually destroying fertility. The lifestyle ones are things that we have the option to change, and we can practice truly informed consent around. Okay, so again, without basic literacy, we can't practice truly informed consent, and I think this is actually a really important point, I think, for parents especially, and parents of young girls. I often, I'm sorry that I'm a little bit nervous and I didn't do justice to my favorite slide, which is actually on the synchronization of all of the cycles of life. These are really great tools, these spinning wheels, for anyone who has a daughter who is still bleeding herself, to actually figure out what you sort of like where you are in your cycle, how it coincides with the moon and the season, and also to understand the energetics around various stages of your cycle and how that affects your life. Because it does. I mean, it's not a coincidence that women should actually choose during their follicular phase right before they're ovulating to do their most important work, because they have an increased energy. They're more sexually desirable. They actually have a really full, ripe life force. Okay. So we talked about the cosmos a little bit. I didn't do it as much justice as I usually do. I'm very passionate about it. We talked about the chaos agents. Now I want to talk about the ways in which we can potentially restore harmony. And I think one way we can do it is what we're doing here tonight. I was in Utah last week or 2 weeks ago. There's been so much going on. 2 weeks ago for the Brownstone Institute retreat, and Jeffrey Tucker asked me, how do you feel about how things are going in terms of the federal reform within HHS and the MAHA movement in general? And I said, well, I wouldn't put all of my eggs in that basket. And, the truth is that federal reform is often mercurial. And we can do a lot to dismantle the CDC, which thankfully we're doing. We can do a lot to challenge the childhood vaccine schedule, which hopefully is going to see some radical changes. But these things can change in 4 years, 8 years, 2 years, depending on how things shake out with the midterm elections. And so I think it's really important for us to also, even though I will say this, even if things change and they're changed for the better and they get changed around again, we've still changed the cultural imagination about what is possible and what is good, and we're asking the right questions. Next week, we're offering a roundtable in Washington, D.C. with Jay Bhattacharya so that he can tell us what he found when he walked into the NIH on day one. And he can tell us a little bit more about just how difficult it is to actually change policies and how hamstrung he is on certain reforms within NIH. And so I think it's really important for us to actually care about what's happening there. But I also think more importantly, we need to build local capacity for reform at the state level, in our communities, with our families, with our children, and first and foremost with our own selves and our own understandings of where we kind of fall in all of these things. So I want to talk a little bit about some policies that I think are particularly interesting right now. The first one, sorry about my slide. Okay, so I'm going to start actually with the HHS and MAHA Commission. So one of the things that the MAHA Commission was tasked with doing was to produce a 100-day report, which was an assessment of need, and then a 180-day report, which was a strategy document for how they would move forward. And one of the main things that was offered in the strategy document was a piece about fertility, understanding that fertility is a crisis. So there are going to be some education campaigns and root cause assessment of infertility. And then one of the things that I find particularly important is that Title X funding, which is family planning funding, which typically goes to Planned Parenthood and others, is going, and it's congressionally mandated, and there's a huge pot of money there, I can't remember exactly how much, is going to be retrofit in some ways to include infertility training. So training for doctors to treat infertility, because yes, it is a crisis, it's a growing crisis, it's only going to get bigger. And in terms of legislation, There's a few things at the state and federal level that are really important, and this list definitely does not include everything. But I do want to mention one thing, which is pesticide liability shields. Just as vaccine manufacturers in the 1980s created liability shields, now the pesticide manufacturers are doing the same. And they're trying every single way to get this into the states and to get it into the appropriations bill. So we have two challenges right now. There are about 22 states in the country that are facing pesticide liability shields. That is an ongoing fight. It's mostly in the red states. These are big chemical manufacturers who are making a lot of money off of poisoning us and our children. So one thing you can do is support an understanding about why these pesticide liability shields are so harmful, and if you're in a state that's impacted, which Massachusetts is not, to vote no. So that's one thing. At the federal level, the big chemical industry is trying to get appropriations language in. There's Section 453, which basically what it does is it prevents labeling, which would essentially provide a backdoor to pesticide liability shields at the federal level. In which case, these state issues are going to be over. Basically, it'll provide liability no matter what. So even the state fights won't matter. So we're working really hard. We think we actually have some pretty good traction there. There's a lot of advocacy happening, and we understand that the president is actually in favor of getting that language stripped from the appropriations bill, so we're in pretty good shape. And then there's something called the Restore Act, which is actually a federal bill. Sometimes federal bills take a couple of years to socialize, so it actually hasn't gone very far, but it has actually in one state been introduced, and I believe that's Arkansas. Okay, so that is Arkansas. So the Restore Act is a Reproductive Empowerment and Support through Optimal Restoration Act, and it makes access to holistic, non-invasive fertility care federally recognized, studied, and funded alongside traditional assisted reproduction. And so if you want to look a little bit further into that, I'm not going to go into detail, but there is a big movement called restorative reproductive medicine in the United States of America, and it's really important because it starts with basic body literacy, and then it moves into looking at all of the things that could be impacting your fertility, including some of the chaos agents that we talked about early on as the root causes, and then looks into addressing metabolic health, hormonal health, to basically restore the body. And in some limited cases, I believe they use as a short-term intervention hormone replacement therapy. But this is a kind of a much more holistic, respectful intervention. So I guess, and there are two more states, I think it's Texas, I want to say Texas and Mississippi, who have Restore Acts, but this is something that you could, if you wanted to create a bill in your state, you could think about doing. It does place a lot of attention on fertility. It is proactive. I think that's a nice place to start. This is more about what HHS is doing. These two programs haven't actually been launched yet. I don't know if you know this, Mary, but there used to be within the Office of Health and Human Services an Office of Population Affairs, and I think that's probably been taken over now by the Office of Women's Health. And I do think, and a lot of this work on fertility education is coming from Natalie Dodson, who used to be with Ethics and Public Policy Center, and she's a big champion of restorative reproductive medicine. We did a roundtable in Washington, D.C. on fertility, and she had helped plan that before going into the administration. So I think we can see at the federal level a lot of attention, a lot of focus, and billions of dollars, hopefully, for studies around fertility. And then just lastly, some resources. I can actually email this to Carol. Maybe we can share it out. But I wanted to, Treating Infertility in the New Frontier of Reproductive Medicine, Ethic and Public Policy Center has a great publication, as does the Conservative Heritage Foundation. They have actually been incredible partners with us on this because they really do believe in family flourishing. And so they've put a lot of resources into supporting restorative reproductive medicine. You can look at the Maha Institute, our webpage. We have a roundup of our fertility and women's health roundtable, and there are a lot of really great videos, including Dr. Sarah Hill, whose book I saw back there. It's Your Brain on Birth Control. It's actually a fantastic book, and she has so many resources on her website. And then, because I didn't do as much justice to her work as I wanted to, Jane Hardwick Collins is a decades-long practicing midwife who runs the School of Shamanic Womancraft, and she has some fascinating resources, especially for women of daughters, for the rites of passage, honoring the rites of passage of menarche, and also honoring for women menopause, and all of our various cycles of life. She's wonderful. Katie Singer, who actually has a book with the Weston Price Foundation, but I actually was introduced to Katie Singer. She wrote The Garden of Fertility. It's a really beautiful book about honoring fertile cycles, and obviously the Weston Price Foundation, Nourishing Traditions. Okay, thank you so much.
So good evening, everyone. Again, just thank you to these incredible presenters. I was blown away by it, and again, in a little New England town, on a cold, dreary day, to hear so much wisdom, so much information is incredible. My name is Daniel Seitz. I'm the board president of Health Rights MA Advocacy. And my colleague, Julie Boris, is also here, who is a force for health freedom. You saw the reference to medical freedom here in Massachusetts. She pounds the pavement at the legislature, telling our representatives and senators about the various harms from these vaccines, whether they want to hear about them or not. So we're going to be doing a question and answer, and I think want to thank the Berkshire Collaborative folks for organizing this amazing event. And as you gather the questions to bring up, I'll read the questions and then various panel members will answer them. But I just want to take one moment to say that here in Massachusetts, for those of you who live here and for whom the health freedom, the idea of health rights, the idea of informed consent, exercising your God-given right to make your own medical decisions, if those matter to you, do check out the Health Rights MA desk at the back there, because we're very actively trying to pass legislation, and Deborah mentioned the importance of working on the state level, local community level, to try to change the legal structure so that it is absolutely guaranteed by law that we have informed consent, which means not only the right to accept medical procedures, but also the right to refuse them. And we can do that because that is our absolute right as human beings here on the planet. So do check that out. And also, as was mentioned, we have books by Naomi Wolf back there. We have the wonderful books from the Children's Health Defense, the Weston A. Price Foundation, which talks a good deal about traditional diets. There's a table there. And again, Health Rights MA. So please do continue to learn about these things, become involved, because we can do it together. You can't stop the spread of consciousness, and there are a lot more of us who care about our well-being than those who might want to control us. So what I'm going to do is read the questions and then hand them to whoever would like to talk to them. In some cases, people have indicated who they would like to perhaps address this first. So here's the first. It seems that the crux of the problem is agency capture, CDC, FDA. How can we expose the capture in an effective way? SSRIs are extremely dangerous for humanity. So just this idea that we understand that agencies that are out there that are supposed to protect our interests actually are controlled by industry oftentimes. Mary, I think you probably would have, actually, I think everyone here, all four of you would have different things to take on this question. So the idea of agency capture.
Go ahead. Yeah, go ahead.
Okay, I'm happy to start. I'm
Sure.
sure everybody can contribute to this. No, I think this is a crucial point, and it's really a symptom of a failed aspect of our society in terms of information and regulation. But just realizing that is important. I usually try to make the point that, you've got the public over here, and then you've got the pharmaceutical industry over here trying to sell products to the public. But between those groups, we really should have good systems of information and regulation, which is like the FDA, the CDC, as well as our universities, and even physicians, the media. And that middle group would be working like watchdogs and day and night to protect the public and properly inform them. That's the way a well-functioning society would look. But in our society, that middle group is essentially working for the pharmaceutical industry. That's the media, the universities, the FDA, the CDC historically, although we're now seeing changes with Secretary Kennedy. But just the realization of this is really important for people to realize that and pass that along to others so that people are aware that the information that they're getting there is not protective, and then to look for sources that are actually speaking truth and are actually trying to protect the public.
I'll just briefly add to that. There's a huge issue with our regulators of the revolving door. They help out the people that they're going to want to work for as soon as they leave. They wait 1 year and then they go make millions of dollars. That's why a lot of people go to work at FDA and CDC, unfortunately. Most of the former directors of CDC, FDA, NIH go directly to pharma and they make a ton of money. The other problem is there's these public-private partnerships. There is a CDC foundation. There's an NIH foundation. There's an FDA foundation. That's private corporate money that basically goes to pay for the day-to-day expenses of those agencies. Just listen, for FDA, it's called the private users, PDUFA is the name of the statute. Basically the corporations are paying for the review of their new drug. Well, how is the FDA going to come, who are they going to side with? They're going to side with the people that pay their salaries. That's just kind of human nature. Also, just one thing that I do think, I was in Washington yesterday and was hearing, I think they're zoning in on this. Scientists at NIH and at CDC and FDA can make royalties of up to $150,000 a year on top of their salaries, and they can pass that on to their heirs. What do you think their incentives are? I mean, it's crazy. This is from 1980. So a lot of things have to change to get rid of this agency capture.
Any other?
I just want to say, on a practical note about reform, a lot of us who supported Secretary Kennedy's presidential run and are excited about him being at HHS, for many people are like, why can't you just go in and make everything happen that we want to have happen? And it's actually a lot more complicated than that. HHS used to be an 80,000 person organization. Now it's 60,000 with all the sub-agencies. And the political appointments are something like 270 total. And of that 270, the president gets some and the secretary gets some, and then they have to go through personnel, and then they have to kind of find their way in, and it takes sometimes months. And meanwhile, the entire country and a lot of the careerists who really are the cynical, nihilistic, careerists are the ones who are running the show until that happens. So actually reform is difficult and very slow moving.
Well, there are some laws out there, but they may not be observed. So a couple questions here about that relate to what is the impact that vaccinated people may have on unvaccinated people. Is vaccine shedding real? Those of us who are not vaccinated are still exposed. Are we still exposed to the spike protein? And then more specifically, if you have someone who's unvaccinated who has sex with someone who is vaccinated, are there harms that can be done? So just this idea of what happens when the unvaccinated and the vaccinated interact in either personally in society or in a more intimate way.
I would say probably understudied, but just from a chemical exposure standpoint, it really depends. It's going to depend on the individual, how much is being transmitted. I mean, we see this, for example, with breastfeeding and medication use. Every mom-baby pair works differently. So the questions often come up, can someone breastfeed, for example, on SSRIs or with vaccinations or whatnot? But it really depends on how that particular mom deposits the drug or the vaccine into her breast milk, and then the baby, how that baby suckles and how that baby gets exposed. So I imagine for every different pair in these situations with vaccinated versus unvaccinated, you're going to just get differing effects. I honestly don't know the research, if someone actually has tried to dive in that and take a deep dive on the research to look at that, but I'm guessing we don't have a lot of data. I would be concerned because we don't really know where all the chemicals are going, where all the spike proteins are going. We don't know how much uptake there is. So I think there's some concern there.
Yeah, I'll just lift out again from what I shared a couple of things that may have gotten kind of missed. Pfizer confirms shedding, and again they describe it or identify it as respiration, bodily fluids, and skin contact. So that explains why. I mean, very often if you're take a flight and you're seated next to someone who's probably vaccinated, you might not feel well. I find that when I sleep in hotel rooms where I'm probably in a bed or a room that's insufficiently ventilated, I don't feel well. So they confirm it. And again, I'll note they know why they told vaccinated men not to have sex with unvaccinated women without two reliable forms of contraception, but they're not saying why. So something that at the administrative level, I understand all the hurdles. I doubt one will get very far with this, but force let us say, what are you worried about in the sperm of vaccinated men? And the last thing I'll say is, anecdotally, I'm hearing from so many women, and this is so interesting, many of them in Israel, because they track their cycles carefully. But so many women have menstrual dysregulation when they have intercourse with their vaccinated husbands, and they also experience much more painful periods, like so painful that Orthodox women are asking their rabbis for dispensation from having intercourse with their husbands because the menses are so painful as a result. Much more study needs to be done. Thank you.
So I think many of us who just lead normal lives wonder what happens in the heights of power in Washington or elsewhere. And we have among our guests, our presenters, people who have actually meet with Secretary Kennedy, perhaps have met with President Trump. We're just curious to know, someone's curious to know, what is your read on sort of how leadership might be at these highest levels, understanding what was said just a moment ago about the glacial pace at which movement happens just because of the sheer number of employees and so forth. So what's your read on whether President Trump or other people in these positions of potential power to change health policy?
I could start on that. I mean, I have worked with Secretary Kennedy for 15 years, and I can say that he is deeply, deeply passionate about, making the people healthier again and stopping the over-medicalization, getting food to be more holistic, getting healthcare to be more rational and actually help people. And I do believe, having observed President Trump, particularly in the press conference with Bobby Kennedy about autism and acetaminophen, where the president went on and on about vaccines and autism. I think the president is very aligned to a great extent. I also was in Washington yesterday and heard Secretary Kennedy interviewing J.D. Vance on health freedom related topics, and I think he's quite aligned. How much they're going to get, it's not a uniform monolithic administration. I was just chatting. I don't think the Department of Agriculture is particularly aligned. I don't think the Environmental Protection Agency is particularly aligned, and that's tremendously disappointing. But I do believe that Kennedy is getting things done. He's only been there since February. As some of others have said, the 2026 midterm elections are going to be critical as to whether or not he can continue the agenda that he's working on right now. But I do believe that the president is supporting the work that Kennedy is doing at HHS.
There are a couple questions around.
Why would the 2026 elections throw a wrench into his?
So I'll just suggest that, sadly, the Democratic Party has been exceptionally hostile to Secretary Kennedy. So I've been sitting in on some of these, hearings in the Senate. I mean, every Democratic senator has asked for Secretary Kennedy's resignation so far, every single one. So if, in fact, the House of Representatives were to have a majority of Democrats after, in 2026, right, 2027, after the 2026 election, I fully expect that there would be efforts either to impeach Secretary Kennedy or to investigate him so that he really can't get anything done. So the control of the House of Representatives in 2026 election is going to be critical.
So there are a couple questions around SSRIs. One is, how long does a mom need to be on SSRIs to cause problems? How long does a mother need to be off of them before pregnancy is okay, or at least fewer complications? And generally speaking, what is the impact of stopping taking SSRIs? Are there concerns about withdrawal or other symptoms that also could independently impact negatively the pregnancy of a woman?
I guess I'll take that. I should have made it clear during the talk that what I focus on, it's a broad topic. There's so much to talk about for 20 minutes, but I'm speaking in the talk specifically about the risks and trying to get the labels changed to better inform the public about risks. So the question I'm trying to answer is, what are the chemical risks to mom and baby? People often though wonder what the second question is, which is a separate question, is like, what should a mom do, or what's an individual supposed to do? That is very patient dependent, and there's no one size fits all solution to that. So I have a fair number of patients who I see in my office who decide to stay on their SSRIs during the pregnancy. And from hearing the first part of my talk, you might be thinking I'm throwing up my arms or some that sort of thing, but that's not what I'm doing. I'm supporting my patients. And a big part of that is this issue of withdrawal. They can be very difficult to come off of. They change the brain chemistry and a whole bunch of different receptors and a whole bunch of things that we don't understand. I think there's about 100 billion neurons in the adult brain with 100 trillion connections, and we really don't understand how it all works. When patients have been on these for a while, they'll often have a great deal of difficulty coming off of them. It's an interesting phenomenon, though, because about half of women stop their SSRIs when they get pregnant. It's roughly half, and I see that all the time. Some of them are able to do it without much difficulty, but others have a great deal of difficulty with it. And because of that, they will then weigh avoiding withdrawal as a benefit into their calculation, which is a legitimate thing to do. They're trying to weigh that. And what that weight is very individual. As I said, there's no one size fits all solution. So for my patients who tell me, look, I've tried coming off previously and I can't come off the medications, I do really poorly, I've decided to stay on it. What do I do as her physician? I support her and continue to see her, and I'll see her for the next ultrasound and take good care of her throughout her pregnancy. So it's just to try to answer that question, there really is a no one size fits all solution, and it really depends on the mom. In terms of,
I don't want to interrupt, but I want to ask a question when you're done.
in terms of length of time, it's most well studied looking directly at women who are on them or off them. Could there be some residual chemical effect, like on the ovary? Could there be residual chemical effect in the body? Absolutely. But when we look at it, it's just a chemical exposure issue. The less chemical exposure, the better. Even for moms who reduce their dose, it looks like most of the studies that are well done do show a dose-response relationship. So even for a mom who can cut down her dose, she's going to end up putting less chemical into herself, less chemical into her baby.
Oh, sorry to jump ahead of others who are waiting, but I must ask, I feel like the Overton window has been moved since I was pregnant, because I gave birth in 95 and 2000, and you weren't supposed to put anything in your body. I was nothing. I was on SSRIs. I got off. It was hell, but I guess what I'm wondering is the culture seems to have, and you're a noble opposition to this, but the culture seems to be no longer saying to women, nothing, 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 nothing. Because if it said nothing, then you go through that nightmarish withdrawal, and you have to, and there's no alternative. Do you see what I mean?
Absolutely. Yeah, I think there has been a move away from that towards more exposure. And I think part of it is just the influence of the pharmaceutical industry, and also that so many non-pregnant patients are on these, and then that spills over into pregnancy. But what pharma's done is actually they know that that moms have a maternal instinct and they want to do everything that they can typically for their baby. So what they've tried to do, and they've done successfully, is to spin it that actually the use of the vaccine and the use of the drug is going to be the best thing they can do for their baby. So if they want, you see ACOG saying this, the way to have a healthy pregnancy is to get the vaccinations during pregnancy. The way to have a healthy pregnancy is to stay on the chemicals regulating. So this is how they've been able to spin this, which is getting away from that whole concept of reducing or avoiding chemical exposures that used to be, everyone, used to follow more of a precautionary principle in pregnancy.
Thank you.
So this next question reflects the fact that I think many people feel like there are two distinct worlds out there that are like ships passing in the night. There are those who are questioning the vaccine narrative, who are out there understanding that there are harmful effects and so forth. And then there seems to be a whole nother group of people who just believe the narrative. And if you try to provide some information, they look at you like either you're crazy, we hear conspiracy theory, so forth. So just a question, you all who are so knowledgeable, how do you go about having these conversations with people who are resistant to these ideas? And do you find that worthwhile? But what's your experience, and if you feel that there are any tips that we can have so that we can restore this type of conversation?
I'd like to start on that. Children's health and vaccines should never have become a polarized topic, but they are, and they're very political at this point. There's a new book that just came out, which is called Forbidden Facts and Unwanted Truths by Gavin de Becker. And he actually did a Rogan interview yesterday. I think it'll come out any day. What's great about it, it's a short book, and it basically makes fun of the doctors and scientists at the Institute of Medicine who are talking about the issue of, mercury preservative in vaccines. And you realize that there is no science in these deliberations. It is all about the messaging. And they start the conversation with, we will never pull the vaccine from the schedule. We will never say that it's unsafe. And so you read it, and he actually makes fun of this conversation. And so it's kind of light. And it's easier when people read this, they're like, this is the Institute of Medicine. This is supposed to be like the highest medical authority in the country. You start to see that this is not really about the medicine. This is about the money. This is about the liability. I think that it's a new tool, and I hope it will be helpful in waking some people up, because I know all of us struggle in our lives with people who are unwilling to listen to what we see as sex. I would just also say I find movies very effective. So there's lots of free movies on the Children's Health Defense website. It's like, ask me, would you watch a movie for me? Would you spend 2 hours, and could we talk about it? That's somewhat effective.
I'd love to. Well, I just want to thank CHD for I don't know another organization that's done as much to make these messages absorbable with great delicacy and power. Very concrete thing you can do if you want to communicate these difficult issues better is not rely just on yourself, but support independent media and organizations like CHD and like the organizations and people represented here that you follow. All of us, I'll speak for myself, but I don't know a warrior for independent facts and journalism getting out there and studies who isn't going through this. We're tired, we're broke, we're depressed, we're burnt out. I'm not kidding. I'm not going to take the SSRIs, but like there's such pressure to keep doing the thing, but we don't get the resources from our people who love us so much. So it's like, it's nice that, so many people love us, but a fraction of those people send us checks. I am not a mercenary person, but it costs money to produce these movies that they're producing, to produce CHD TV, to produce, Daily Clout, the Maha Institute, all the things. Following you. I don't know what but buy his book. Like, I mean, I'm not kidding. That's so important. And the last thing I will say, and then I will stop, is I honestly believe a friend of mine, Aura Niedrich, is a kind of awareness expert, and she said she thinks there are two different dimensions on this planet right now, and that's why we can't even communicate with each other. And I honestly have started to think about all of this like it doesn't make sense except in spiritual terms. And I love some people, but we are in a sliding doors moment, and I just pray for them and for all of us. So that's all I want to say about that.
It's I was with Brett Weinstein on at the Brownstone Institute retreat, and he was talking about there being, from a biological perspective, different phenotypes, different types of people, and this, I don't want this to come across the wrong way, but he basically said that everyone here who's challenging the narrative, who realizes that we have a better story to tell, who spoke up, who challenged things, is part of a particular kind of phenotype. And we're really good when shit like this hits the fan and there's an attempt at authoritarianism, because those of us we were made for this time, right? And it was actually a really beautiful story the way he told it, because I think there is something to that. I think there's just a certain type of person, right, who can kind of survive these times. And I don't think we need everybody to agree with us on all these things. And it might actually be, in some ways, not a good use of our time to always do that, but to seek to kind of do the good work and connect with each other and fortify our own efforts.
I try to just remind people that we're all on the same team when I have a discussion about these things. And then I also find it's very helpful to do my best job that I can restating that person's point and trying to really understand what they're saying, so I can make the strongest argument for what they're saying in order to be able to kind of get in their terms. And then also trying to crystallize the information and have simple points. That's why I say things like serotonin is a crucial hormone for the formation of the brain, and this disrupts serotonin. The simpler you can be about things that we can all agree on, I think makes the point simpler to make.
That's great. Nice.
I find it interesting how many people I've heard say, I was born for these times, in a way, that this is an existential struggle, but so many people are up for this. So, and certainly we're blessed to have these champions behind us who are working so tirelessly in this direction. So I just want to end with one more question, and this is, what thoughts or practices help you remain hopeful when you feel tempted to despair?
I'll take a stab at it. I've been spending a lot of time in Washington, D.C. these days, and we have like a salon that we do every 2 weeks, and we bring people together from within the administration who are all kind of aligned with reform and wanting to do things. And I know that a lot of people have given up a lot to become public servants during this time, to make very little money to live in Washington, D.C., which is mostly filled not with allies. And actually does give me a lot of hope to see how hard people are really working at this problem. Here in this community gives me a lot of hope, because I feel like we're all willing to come together. Thank you so much for organizing and bringing people together. I think this kind of keep telling the good story about what it means to live, to kind of have a wholesome life and a wholesome appreciation for life. Our story actually wins. It is a good story. It's a life appreciating story, and I think nothing kind of beats that.
I see hope every day in the office, certainly with events like this, and I'm deeply appreciative of you guys doing the event and everybody coming out. But I see a lot of hope in the office. I mean, as an example, with vaccinations, the pregnant women these days are bombarded with the importance of getting all your vaccines in pregnancy, and if you don't, you're being a bad mother. They're being hit with this information, and there's basically 100% agreement among the establishment to get these, but women aren't getting them. A lot of pregnant women are declining these, and those rates are quite low. They're still, depending on the vaccine that you look at, hovering around the 50% mark. But overall, most women, the majority, more than 50%, aren't getting the 4 vaccines that are recommended. And so I think that people are thinking for themselves and questioning things, certainly after COVID.
I actually, I also am very optimistic. I don't feel despair. Sometimes I feel tired. Sometimes I feel very angry. But I don't feel despair. I'm just coming off of, we just had a conference. We had 1,000 people there. We had to turn people away. The energy was incredible. We are getting very, very close to a tipping point. We really are. So I see a lot of optimism. You're very close. You never, when revolutions happen, the people in power never see it coming when it does, right? We're getting very close to the tipping point. They just don't realize it, but we're getting really close. Yeah. It's true. It's true.
I guess I would. Oh, I'm sorry. Oh, well, I'm lucky that I'm married to a veteran because when I complain about these battles, he doesn't let me, and he says, battles are short, but wars take years. So that is helpful. And I guess the other thing, not to get all like religious, but I have been reading the Hebrew Bible kind of in Hebrew and then comparing it to English translations on video for a long time. And over, it's the same story that things are really bad and humanity is about to be completely destroyed, or, this little group of people is going to completely be wiped out. And, God always sends like one guy or one lady or, six people to do the right thing, and then divine providence aligns behind them, and then they can overcome any opposition. So I'm counting on you guys to be those people. Thank you. That's what I do.
Okay, thank you guys for coming tonight. It's really inspiring for me to see everybody here. This started at a dining room table, and we're filling up rooms now, and with another, we're just going to keep going and going, and it's just really inspiring for me to see it happening. I just want to invite everybody to come to one of our potlucks. We have a potluck every month, and sometimes we'll discuss speakers that we'll have, and sometimes we'll just have a overall conversation about how we deal with Lyme disease, or maybe somebody will teach us how to grow microgreens. There's been a whole bunch of different topics. It's informative. It's good to meet everybody there. It's a social event. We are wanting to learn. We want to learn from each other, and that's why we're here, to teach and to learn, to inspire. So if you are interested in coming to our potluck, please make sure you're on our email list, because that's how we will inform you where we're going and what time. So there's a panelist here, just amazing. Thank you guys so much. This is really incredible.